What are attachments and what is IPR? IPR stands for interproximal reduction. So first of all, attachments. Basically, attachments are white coloured material that we place onto your teeth in a template to aid the movement of the teeth. So basically what happens is when we get your clear aligners, so these are only for clear aligners, when we get your clear aligners, we usually get given a template to where we're to place these white filling materials that match your teeth exactly. So what we would do is we would place these on, which will then allow the teeth to move in the direction in the way that we want them to give us the result that we want. It's painless, there's no injections involved, it's very, very straightforward, and once they've been placed, patients don't even notice that they have them on, especially when the aligners go in over the top of that. IPR, so interproximal reduction, is basically when we need to try and create some space in between the teeth to allow teeth to move past each other. So we don't tend to take teeth out to try and create space. Through an algorithm that we use through one of the many clear aligner systems, we get given a guidance in terms of where we need space between teeth, so we can use little strips, little metal strips, almost like a little nail file in between the teeth, very, very thin strips to then create the space. Alternatively, we can use a little, what we call a mosquito burr, which is a really, really small instrument, which helps create the space that we need in between teeth if we need it. Because we are removing very, 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 very minimal amounts of tooth enamel, there should be no long-lasting effects on teeth in terms of sensitivity, in terms of pain. Everything is done in a very controlled manner, and everything is usually smoothed off, and we explain to patients well in advance of what it is exactly we're going to do, and also show patients as well, so you're completely aware of where we're going to do it, how much we're going to do it, and when we're going to do it, to give us the best possible result. Again, it's something that I've not had anybody say to me that they didn't want that done, because it really does help with moving teeth around, but I like to explain it in a little bit more detail when in the surgery, and I can show you as well exactly what it is that we use. So there's nothing to fear on that side of things.